FM. Good afternoon.
In a land of broadcasting and a time of declining family values, the destiny of great radio rests on the shoulders of Super FM.
Good afternoon and welcome. It's 1 p.m. on the DOT. Today is Monday, the 2nd day of June, 2025. My name is Joyce Chooks. I'm live right now on Facebook. You should join me. We're at Superfmbenin and welcome to Mother and Child, our quintessential parenting show. We talk about everything parenting, child health, mother health, and very recently, we've welcomed fathers into our conversation. Every Monday, I'm here with a medical rep who has rather eye-opening information, eye-opening conversations for us to have. And today's zone has me very, very excited. Now, I did mention earlier on the handover show, if you had joined me, what we were discussing. But if you didn't catch that vibe, that's okay. I have my guest joining me via phone call. Now, this show is sponsored by the T.Y. Danjuma Foundation in collaboration with the Baum Empowerment Initiative. I'm joined with Dr. Mrs. Igudao, and she is from the Edo State Primary Healthcare Development Agency, and we're discussing pregnancy. Hello, doctor. Good afternoon.
Good afternoon, ma'am.
So happy to have you on the show today.
Thank you very much.
All right, so before we dive in, I always give my doctors a small 30 seconds to 1 minute to properly introduce themselves.
Okay, Dr. Igudaro. I work with the Edo State Primary Healthcare Agency. That's all I can say for now.
That's the one that I said too.
Okay? Married with 3 kids. I think that's fine.
Fantastic. Knowing that you have 3 children of your own, would mean that you've had at least 3 pregnancies, except you have twins or triplets. But if they are individual babies, then at least you would have experienced 3 pregnancies in your time.
No, it's 2.
Oh, 2. So you have twins?
Yeah.
How's that going, by the way? I've always wanted to ask mothers who has multiple children, the earliest days, how is that like juggling 2 little babies? The normal stress a person would have from 1 newborn. How is it like having 2 newborns?
It's double. Let me put it that way.
In fact, that you started with, tell me all I needed to know. Well, I was really informed that today we're talking about pregnancy, the causes, the consequences, and the prevention. I was privy to a very, very interesting conversation one time, and people were talking about quote unquote unwanted pregnancies. And somebody had said that they're always so surprised when a person announces an unwanted pregnancy and says, if for some reason you've engaged in intercourse, then you should have it at the back of your mind that a very likely possibility is pregnancy. So whenever it does come, people should not be surprised. But there are people who take, active steps using different types of contraceptives to maybe prevent the eventuality of an unwanted pregnancy. But let's start from the base and then work our way up to the top. What is pregnancy?
Okay, pregnancy can occur when a male meets with a female. There's fertilization of the ovum, which is produced in the female. The sperm is what fertilizes the ovum, and a zygote is formed. So that is where pregnancy starts from.
Straightforward and straight to the point. I was informed that people would love to know the causes of pregnancy. I feel like there's one cause, but if there are more, doctor, let me know.
Causes of pregnancy. Pregnancy is when a male and a female have intercourse. That's when they meet.
Let me twist it this way, right?
Okay.
Because when I saw it, I was like, causes. Well, we already know the cause now. They did something, and this is the cause that we're having right now. But let's do it this way, because some people who have experienced pregnancies that were unplanned pregnancies, they would always say, oh, but we were so safe. Oh, but we had pulled out. Oh, but we had worn a condom. So even when there have been contraceptive practices in place, is the eventuality of pregnancy possible? still. And if the proper contraceptive measures were not put in place, like instead of maybe using a condom, using different family planning methods, they decided to quote unquote pull out as the way they were so sure. Can a person have contraceptive measures, whether they are crude or they are more tech forward, and still experience a pregnancy?
Okay. For some persons that are not, let's say the contraceptive they use as expired, that one, the person might get pregnant. If, for instance, the person feels, let me say implant, no, and it's meant to be for like 3 years, and the person didn't take record of when when she fixed it and the date got passed and she had intercourse. Certainly she will get pregnant, but she will tell people that she's on contraceptive. Then those that are on oral pills, you're meant to be taking it daily, and maybe one or two, as in maybe they missed it, they were not able to take their drugs the way they're meant to take it, and they got pregnant along the line, they'll say they're on contraceptive. Okay, so those can cause people to have pregnancy along the line.
Okay, so improper measures for contraception can lead to pregnancy if you did not intend for pregnancy to happen. Now, while I was still going over my course of this conversation, I was talking to our partners and what the directions they would love for us to take this conversation. I was surprised when I saw consequences, for pregnancy. And that gave me the idea that we want to talk about unwanted or unplanned pregnancies. So when a person has an unplanned pregnancy, but it happens irrespective, what should they expect? What is now coming in front of them?
Sorry, I didn't get the question properly.
I said when a person has a pregnancy, whether planned or unplanned, what should the people be expecting? When I say people, I'm talking about both the male and the female partner. If all things being equal, the male is supposed to be very active in the pregnancy process as well. So if a woman has just found out that she and her partner, they are pregnant, they're expecting, or they did not intend to get pregnant, but it has now happened, and they're listening to the show, they don't know what else to expect now that they've gotten a positive pregnancy test. What are some things a woman starting off, can expect as soon as she gets a positive pregnancy test?
Okay, what I would say is, what from my own perspective, from what I would say is that they should keep the child. In Nigeria, it's not permitted. We are not permitted to carry out an abortion.
It is still illegal in Nigeria. Yes.
Yes, you understand. So the highest they can do is keep the pregnancy, go for antenatal care. The man should support and get the baby when it's due date.
Okay, so what I would love to do, if you could probably do that for us, is to give us a bit of a detail on the process. Now, what I mean by detail of the process, I have just come back from the laboratory or come back from the hospital. I've received the test. I opened the envelope. It says positive for pregnancy, and I've never been pregnant before. What are some things that I can expect to start happening to me? What kind of changes will I start experiencing in my body? What should I do medical-wise? Now, for example, you've mentioned antenatal. Some people still do not know what happens in antenatal, how they can even get to antenatal. Should a person now head down to their closest primary healthcare center or closest hospital? There's also the question of the place you do your antenatal, must that be the place you give birth? So just a robust information. Let's assume that you are writing an information pamphlet for a person who has just gotten pregnant for the very first time.
All right. So when a person goes to the lab to do the pregnancy test and finds out that she's pregnant, or maybe at home she does the urine strip. She uses the urine strip and she finds out that the red line shows that is positive. It shows positive. The next thing she needs to do is get herself prepared physically and emotionally for the pregnancy. She then takes it higher, goes to a nearby healthcare center, or if she decides she wants to go to a teaching hospital. Depends on your choice, what you want. You go, you go and register. When you get there, what they do is all the required investigation that is needed for a pregnant woman, you go through them. They will tell you to to go through the test. You do all those tests. They get those vital information and put in your case note. Then also be told when you will be coming for visits. In those visits, when you come, you are being educated. You are being taught what pregnancy is all about, the things you will notice. Like during the first trimester starts from when the woman conceives to the first 13 weeks. There are some changes in the pregnant woman. Some of them, you find out that they can't eat. Everything irritates them. You're always throwing out sputum. They're always throwing out spit. Some of them, they are very selective. The food they eat at that time, it's not what they normally used to eat before. Okay? Then also too, maybe spray, perfume irritates them. They don't want to perceive anything. Depends on the individual. But what I know is mostly common is that reduced appetite for food is there, which improves after that first trimester. From the 14, 15 weeks, their appetite starts improving till they give birth. Also, too, they also tell them, they also tell them that when they notice anything out of the ordinary, they are meant to come to the hospital so that we can be able to assess and tell them that, okay, this is right or this is not right. Because, for instance, some of them start feeling pain, they don't even know the cause of the pain, and they sit at home. Do you understand? They just sit at home and they don't even want to know where the pain is coming from. Why some will run to the hospital. Then when they come, we ask them, okay, where are you feeling this pain? They'll be able to tell us where they feel those pain. And when we know that, okay, this pain is, let's assume it's the abdomen, they're having abdominal pain. What we do is we ask further questions. Are you bleeding? Is the pain, are you having sharp pain, or the pain is just mild? Some of them will tell you it's very, very, the way it is, it's so painful. And I saw some blood. Then we know that this woman is maybe tending towards having an abortion, a miscarriage. Then we step in. So all these things, they educate them so that as the pregnancy is progressing, you're being carried along. You're not just left at bay. We're all moving at the same pace, so that with anything that needs intervention, we quickly step in. Then second trimester, that one is around that is from the 14th week to around that 28 weeks thereabout. Okay, that's one. There's really nothing much like that. Really nothing much, because there the appetite has improved, the patient is doing fine. What we just ask is, okay, do you feel most of the time we ask them if they feel their baby moving. Some of them will tell you, yes, I felt. Then we start giving them some medication that can help, like we call it ITP, that is to help prevent what's the name, malaria. It's not to cure it, it's just to help prevent. Okay, to help prevent. So we give all those ones to them. They give them their medications that already we started in the first trimester. Their basic routine drugs, which they are meant to be taking. Those to help build the blood. Those to help prevent neural defects like the folic acid. Okay, then they want to build up blood is to prevent anemia, because if the patient is anemic, the patient might likely put to bed before time. Okay, and the child might not also develop well. The child might likely be a low birth, and the child might come out as a low birth. All right. So those are the things that we normally do. Then the third trimester, from that 29 weeks down to when they put to bed, there's nothing really. It's just for us to be checking to know if they have any complaint, why we are expecting them to put to bed normally. Then if there's anything that maybe the child is not well presenting, any indication that will warrant us to tell them to go for a cesarean section, then that period we also tell them to prime them, we'll make them know that, come, these are the things we are seeing that will make you not to give birth the way you're meant to. So a cesarean section will be of more benefit for you and your baby. So those are the things that antenatal is really all about.
All right, let's dive a bit deep into a question that people normally ask. The place you register for antenatal, is it absolutely compulsory that you have to give birth there? That is one. And two, should pregnant people or people who are expecting, should they put into cognizance the distance of the hospital when choosing where should be their antenatal or birthing hospital?
Okay. For the giving birth aspect, okay, let me just start with the first one. Where you register, I would advise that you give birth there. Why? Because they have your history, they have your details. When you go to another place, another facility to go give birth, it's like you're starting all over. All right. If, for instance, a lady that has what's the name? Hypertension, pregnancy-induced hypertension. Maybe when she goes there, she might not be able to tell them that, oh, see what they discovered while I was in so and so place. Those ones will not have to start all over again. And even when she goes to another facility, all the investigation we did initially, all those antenatal investigation that we did, she will spend money doing them all over again in the new facility she goes to, even if she's in labor, because there are some things that are basic. We want to know if this woman has HIV, so that when the baby comes out, we'll know how to start management for the baby and how to also help her too and counsel her as regards breastfeeding and how the baby will be fed. You understand? Then we, through the health worker, we have to also be cautious so that we don't end up carrying blood infections back home. So those are the things. If she decides to go register in another facility, so all those things will be found, all those investigations will be done for her, all those informations will be required of her all over again. So I think it will be best for the lady where you register, they know you, they know everything about you. So putting to bed there will be easier and better for that patient. But some patients don't want that. One thing I will always tell them that it's not like it's a prison where you must stay there. Make your decision. If you know the other side will be better for you, you can go through all the rigors again. No wahala, no problem. Feel free and do that.
Okay. And
then
the
for the other one you asked, for the other question you asked about the distance, it would be nice you register close to your house so that when you're in labor, within few minutes, few hours, you're at the what's the name? You are at the center to be to put to bed, or as in, how will I say it now? You get to your delivery facility faster compared to where you register is very, 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 very far. Sometimes the stress on you, the road might not be good. Okay, let me just give an instance. Like when I was pregnant, where I did my antenatal because because it was straight, I couldn't go to a health center. I had to go to what's the name? A secondary health center.
Yeah.
So whenever I'm going, because the road is bad, I find out that I'm always having this serious waist pain. And with the knowledge I had as a medical, I found out that I was almost entering into labor when it was not yet time.
Wow.
Because of the road was bumpy, so it's like I would go up, come down, so it was really having effect on me. Even going to work was a problem. I had to write to them that I'm in preterm labor. I can't be coming to work again because my road is bad. So just imagine if it was close to me, maybe the way I was going to, I just throw there, come back. I won't have that challenge. You understand? That is one out of many. I won't have that challenge. But because where I was going was far and the road was bumpy, it was really bad. Whenever I enter a gallop, God, it was like I'm seeing hell. So I had to write to my place of work. They told me to stop coming to work. I thank God at least that one they helped. Then when I went to my what's the name, to my hospital, the doctor was like, we have to do something fast so that you don't end up giving birth to this baby when it's not yet time. So I had to be on medication. It got to a time that the medication was no longer working. So I had to give birth to them a week before the time. So those are the things. If the health center is close to the lady, why not go there? As far as you have competent and you have people that are on ground always wanting to help, go there, register, so that when it's time to give birth, you quickly run there too and they will attend to you. If there's any need for intervention, we know who to contact in our was in the health center. We know who to contact. I've several cases I've referred people. I'm like, okay, this case now is not the one we're going to handle here. I'm going to send you to this other person, which is also another higher health center compared to the one I'm in. They go there. Before the next 5 minutes, there's report that, she has put to bed, the baby and mother, they are alive, they are safe. And we are all happy. The end result, what we want is mother and baby safe, alive. Yeah. That is not said.
Amazing stuff. Thank you so much. We're going to the final moments of this conversation now. So we're going to circle back to what we discussed in the beginning. We talked about what pregnancy was. We talked about what activity can get you to fall pregnant. We also talked about the fact that these are the things to expect when you are expected. Now, some people, they may not be ready to be expecting, and they would love to have a certain level of control over when they're going to expect. So what can people who are not planning to get pregnant at the moment but are actively involved in the thing that leads to pregnancy, how can they prevent pregnancy? Number one, of course, is abstinence. If you don't want to have a baby, maybe don't do that thing.
Don't do it, yeah.
But are there other ways that people can prevent pregnancy?
That one is the use of contraceptives. And what they need to do is go to a good healthcare center where they will be taught. That one, they teach them, they sit them down, teach them, because there are various methods. So they teach them the various contraceptive methods, and the one that will be suitable is not the one that is suitable for me, that will be suitable for the next person. Okay? So they tell us all, like for people that have hypertension, for instance, now they don't use hormonal contraceptive. Then for people that maybe they want to give birth already, let's assume they are married and they want to give birth in the next 3-4 months. In the next 3-4 months, they don't go for the injectables, because that one takes time for them to, it takes time for them to return back to fertility. So all these things they teach them actually. So they teach them so that according to your own peculiarity, you will know which contraceptive you are to use. Like some persons, they will tell you, I don't just want to get pregnant again. For the next 12 years, they have contraceptive for that. Some persons will just tell you, I just need 3 years. 3 years, I'm okay. Some persons will tell you, I need 5 years. We have those they are contraceptives for all those ones too, all those years. So it's just for them to go to the healthcare center. Then the people there will teach them. Then they will now make their own decision. What we do is to teach them. After teaching them, they make the decision. It's not us that still make the decision for them. It's just for us to make them have the knowledge of what it is. Then they choose and we go ahead.
And when it comes to contraceptives and whatnot, I know like 7 times at least I've mentioned the pull-out method because that is one method of contraception that I do not support. But there are also some very interesting myths on how to prevent pregnancy. One time I had a young lady tell somebody else that once she has had unprotected sexual intercourse, she'll just quickly drink gin. See that the gin will just wash it down. So I would love if you could make mention of some interesting things people consider contraception that is simply not contraception, or at least doesn't work as well.
No, those are not contraceptives at all. Jean, it is not. So I have to be truthful. It is not, because whether she lies, if she's in an ovulation period, and the sperm and the ovum as fertilized, as in they fuse together, my dear, whether she drinks all the gin or not, that child will be implanted in the uterus and she will give birth.
Oh, we got all year. Let me say, as you finish, you don't rush, kai. Say that it's going to work. I've also had, when I was in uni, somebody said it was it was the ampy clocks. As soon as she's done, she will just take 2, and that's all. That's it. To now wash it, to kill the sperm. It was
It's not do anything. It's not do anything. Yes, what that ampiclox is going to do is going to kill any bacteria that's in the blood. The child is not a bacteria, so it will not kill it.
Alrighty, we have less than 3 minutes, about 2 minutes and some seconds left in this conversation. What would you love us to take away from all we've talked about today?
Okay. I'll advise couples that they should plan their pregnancy. They should plan it, because if you plan the pregnancy, you'll be able to take care of the children that comes. But if you don't plan it, it's going to be like chaotic for them. They are running a task scatter. They can't take care of themselves. They can't take care of the children. Everybody becomes a nuisance at the end of the day. So it doesn't make sense. Let me put it that way. It doesn't make sense. So they should plan their pregnancy. Pregnancy can be planned. After giving birth to the first one, if you know that, okay, I just want 3 children, then send your wife to go do one of the method of contraception. She should put it on. Then when next you want to give birth again, she removes it. Then you continue like that. You can be able to. Then after she has done, giving birth to the last one, you go for a long-term contraceptive. That way, you can plan your life and plan the life of your children too. That all of you end up being happy. Then also, when a woman is pregnant, she should please go register. There are some things that you might take as ordinary, but it's not ordinary. Okay, like some women, when they are pregnant, they have discharge. To them, it's like normal discharge. But that discharge sometimes can lead to preterm labor. Some of them can lead to abortion, miscarriage. The child, you're like, but nothing. What happened? They keep asking questions. Some of them will say they throw them arrow. It's not any arrow. They should go to a hospital. By the time they see all these things, they are able to. They can be arrested, and you carry the pregnancy to term, give birth to the child that you want. So these things are really, really necessary. Then also to some women, when you register for antenatal, try as much as possible to listen to what the doctors tell you. Like some persons, after you've given them all the clear cut, you've told them everything about the pregnancy. Come, see the way your pelvis is. This child cannot come out. Your height too is a contributing factor. Your pelvis is nowhere shaped for the baby to come out. So we are going to carry out a cesarean session for you. They'll tell you, God forbid, it's not my portion. They'll leave the health center, go to one place like that. At the end, they come back to the hospital for us to start repairing and start treating, and baby is born. You understand? So we're not there. We're not enemy to the patient. We are friends to the patient. That is why we are there to help guide them, to give them assistance. Where there's need for intervention, we'll tell them so that they too can come out happy, and baby is also happy. The entire family is happy. We are all rejoicing at the end of the day.
I understand. Thank you so much, Doctor. This has been very, very eye-opening. I hope that we can have you on the show very soon again and we can talk some more. Have a lovely, lovely afternoon.
Thank you very much. Glad to be here too.
All right. That was Dr. Mrs. Godaro, and we've had such a robust conversation on pregnancy. This show was sponsored by the T.Y. Danjuma Foundation and our friends at the Bowel Empowerment Initiative. My name is Joyce Shooks. This has been Mother and Child on your One Family, One radio station, Super 88.1 FM. Good afternoon.
They rock out.
Super 88.